To work is that there will be a timer I'll put here, and the timer will be 50 minutes. So every time the 2 minute hits, you start talking. Once the 10 minute hits, I'll send the next question, and then you have 2 minutes to think, and then 8 minutes to talk, 2 minutes to think, 8 minutes to talk. Does that make sense?
Okay, yeah.
And let me just put timer in here.
Is the timer going to be on the screen?
Yes, it will
Okay,
show up now. Do
yeah.
you see it?
Yeah.
And here is your first question.
Okay, have we started the 2 minutes?
Yeah, you start at the 2 minutes. So
Okay.
when it's 48.
Okay. Hello, my name is Sumaya Imran, and it's a pleasure being here today. How might I address you?
Hello, Sumaya, nice to meet you. You can call me Abd.
Okay, thank you, Ab. So the prompt I was given really presents an ethical dilemma. On one side, it's about protecting patient autonomy, but you're balancing that with another priority, and that's providing like life-saving treatment for a patient. So patient autonomy is something that's really important to respect in this case. And what I mean by that is the patient's right to essentially make their own decisions about their healthcare. And that's important, even if you think of it from like a personal perspective. Going into any healthcare facility, I would want the doctors, physicians, nurses, all healthcare personnel to take my interests into account. And that includes things like religious beliefs. So in this case, with Jehovah's Witness and refusing blood transfusions, that's what I would be respecting, because I know, again, myself as a patient, I would want them to respect any religious or even personal beliefs or values that I hold. So that's one of the things that I take into account with this scenario. But then the flip side of that is the providing life-saving treatment aspect. Because as healthcare professionals, our duty is to care for the patient. And of course, that means that we are saving the patient. So in this case, we have the means to do so. And that would be the transfusion for the patient that's in a coma. And so that might be sort of the gut instinct or gut reaction to the presented case. But again, because we're balancing two things here, I think one of the first things that I would do is try to gather more information in terms of looking at this card that was presented, the Jehovah's Witness card. The prompt said that it was recent. I'd like to find out, like, how recent was this? Was this something that the patient signed before they were 18? We can take that into account. Is this something that is a decision that they still uphold? So one of the things that I could do in this situation, again, depending on how much time we have, but I would want to consider contacting the patient's family, loved ones, friends, just so that I can get more input about the patient's wishes before making any sort of medical treatment. But again, in this case, because the patient is an adult, I would also take that into account, that their wishes are first and foremost on my list of who to consider, but they are again in a coma. So I would want an extra sort of safety reassurance before I take any other steps. Another thing is I would look into my options. Like right now, I'm not too sure about exactly the procedure, what would be done. Like, is blood transfusion the only option that we currently have? So I would look into, are there any other alternatives? I might even consult the family members, or if there is anyone else I can provide you more information about, like Jehovah's Witness religious beliefs. Like, is there a way that we can provide an alternative treatment that might work? And again, because I don't know too much about this, I might consult colleagues or even hospitals. Sometimes they have because like ethical committees or someone that I can essentially find more resources with to help inform my next steps, especially if I'm uncertain in this situation, because it's not always that I'm gonna know who's walking in the door and exactly how I can respect those needs. And so I would look into that. I think one of the most important things with a scenario like this is showing compassion and empathy as well. So not only is it ethical principles, but it's also how you are treating the patient, treating the patient's family, for example, that you're working with, explaining your side, for example, like why the blood transfusion is something that you are thinking is the only thing that might save them in this respect, but then also honoring their wishes and listening to them. And so I think, yeah, it's in this case, it's about balancing both things, but also with a sensitive situation, really any situation in the healthcare field, um, documenting everything is another thing that I would bring up in this case, because this can have some legal sort of liabilities and considerations to take into account. If you were, for example, to give the transfusion, and it was against the patient's wishes, or even if you withheld it, like what the reasons were for that. So especially because this is more a sort of that ethical dilemma and complicated situation, I would also stress that that's something that I would do in this. But again, that's kind of my approach to it. I can't give a final answer of whether I would or would not. That would depend on the information I gather from the scene, of whether it's right to give the blood transfusion in this case. But yeah, do you have any follow-up questions?
Absolutely. Thank you very much for your answer. So, how would your approach change if instead of an 18 years old, she was 8 years old?
That would definitely change things. So for one of the things off the top of my head is for an 8-year-old, considering in minor status, I'm not even sure if they have the rights to have like a card or like have their own authority over their healthcare decisions, like their parents are involved in that. And so if this was someone that was younger than 18, then the parents and sort of their say and wishes would take a larger hold than in this case with an 18-year-old. So a lot of that would be me consulting the, so in that case, if that's a parent's wishes, is their child, they're wanting them to refuse transfusions, I would take that into account. But then also I think even if the child is a minor under 18, not considered an adult, it's still important to also consult their wishes. So even if from a legal perspective, the parents might have authority, with healthcare, I think it's also important to ask the child and try to balance those two needs. And that's going to present on the situation if they disagree, if they agree or not. But that's the way that I would approach that if they were under 18.
Thank you very much.
Thank you.
Okay, we have 2 minutes. Do you
Yeah,
wanna
it's a bit early. Um,
like comment at all on anything in those two
Anything
minutes?
else with this question?
Yeah.
Sorry. Um, I think no, I think I'm good. I could summarize it if you want my answer, but I think I have nothing else to add to this.
Yes, but I think you did mention everything. It's very good.
Okay,
Okay.
perfect. It paused.
I'll send the question at 41.
Okay, yeah, I was like, warn me before you send the next one. Okay,
Yeah, no, no worries.
sounds
And
good.
then we can start.
Okay,
Okay.
all right,
Great
let's do
job, by the way.
seconds. Oh my God, I hate like I am not in the zone, but I'll give you the best I got. Okay.
No, you did amazing. Thank you.
Oh, did you send it? Okay, I'm going. Okay.
Yes.
Okay. Hmm. Hello, my name is Swing Ron, and it's a pleasure being here. How might I address you today? Oh, I think we froze.
Yes.
You're back. Hello?
Yes,
Can you hear me?
I can hear you. Yes, and
Okay.
I think it's my internet actually this time. So yeah, my name is Abd. You can call me Abd.
Okay, thank you, Abd. So for the prompt that was given, I think one of the first things I would do to determine was a physician responsible for the patient is to gather more information than was presented because there's a lot of unknowns right now. So for example, one of the first questions that popped into my head was this patient at high risk for an intracranial hemorrhage? So did they, for example, have very high or uncontrolled hypertension that wasn't well managed at all? So they were a high risk patient. Do they have other medical conditions or were they on certain medications to which this might be a side effect? So from sort of a medical perspective was what I was curious about because that would then determine, for example, what the physician would be responsible for in this situation if it was a high risk patient. Was it communicated to the patient that if they developed symptoms such as a headache or severe headaches, that they should seek medical attention? Was it something that the doctor discussed with the patient beforehand? Um, so I think with this, asking those questions, this is important because I'm trying to balance, again, two things with a question like this. For one is, did the physician sort of meet their responsibility, which is to provide care for a patient, even in their absence, to look after that patient if they know they're going to be away? But also from the other perspective of also a patient's responsibility. So for example, if the physician had discussed with the patient their medical condition and had mentioned, for example, like with hypertension, you need to get your eyes checked regularly. You're at risk for intracranial hemorrhage if you ever experience symptoms such as these. And a lot of this stuff is often what, even in my own experience, I've had with physicians, is how doctors would communicate things. Like if you get worse, go to the ER and do X, Y, Z. And so I think a part of that is also a patient's responsibility if they're experiencing symptoms to take action, right? But then you also have to give some leeway to the patient in that they might not know how serious the situation is. And so, like in this case, they waited, right? So there's always a little bit of nuance there. But then on the flip side, um, I have to consider, did the physician actually take any steps, any reasonable precautions in the first place? Like, did they have these conversations with the patient? Or, for example, like in this case, no one was left to provide care to the patient. So if the physician, for example, was working in a group practice, then often you can have your colleagues cover patients or whatever the situation may be in the setting that they're in. But if that wasn't possible, then are there any other sort of steps that are taken? So are patients told that for these 2 weeks' time, it could be the receptionist or that tells the patients, for example, if they're calling in for appointments, like to go to a walk-in clinic if that's available, local pharmacy, go to the emergency room. So were there any steps that were taken for the leave, right? For the physician being absent. But then there's also balancing this duty to provide care to the patients. There's also this other aspect that I would like to address that I think is kind of within this question or this prompt is addressing things such as physician burnout or the fact that physicians are humans. And so if you have, for example, a physician that has a lot of patients and they've done their best in their ability to take precautions or look after those patients for when they're about to leave for vacation or for any sort of circumstance, and something essentially slipped, maybe they missed something or there was a mistake, are we holding physicians accountable for that? Now, you can consider that from a legal perspective and if there's a liability in that case. And so to determine those nuances, I think, especially with this question and this prompt, a lot of the times there are committees that are put in place that are going to review these cases in detail to see whether in this case, for example, the physician being gone and the patient developing a complication such as an intracranial hemorrhage, if there was any sort of legal aspect to that. Because from my personal perspective, I think that physicians should be held accountable, but there should be that nuance again where we are investigating to see if it was really a case of neglect or if they had done their best, but there was something that might have been missed. And so from the physician's perspective as well, if I was a physician, I was returning to this as being a case for my patients. I think one of the big things as well is taking like personal accountability in that learning from your mistakes. And so if this is something that did not go the way that like this is something maybe that you could not have planned for, but then you realize that actually no, there were steps that I could have took so that I can prevent this for future patients as well. Um, that's something that I think is also the responsibility of a physician to take into account. It's just ethically to ensure that they have those precautions in place. And so ultimately, to kind of summarize my answer, I think given a prompt like this, I would for one of the most important things is to gather more information about the physician's actions, about the patient, about the case. And then it would be really a determination of the steps the physicians took as reasonable precautions and balancing that with legal considerations and patient responsibilities, as well as an ethical standard that physicians must uphold in their practice, in their day-to-day practice, and seeing if that was met to determine if responsibility can be assigned either to the physician or the patient in this case. But that's how I would approach this. But I see that we still have time left. So do you have any follow-up questions, perhaps?
Yes, thank you very much for your time. Um, how do you think we can prevent this situation from happening in the first place?
Yeah,
What are
that's a
some ways
good
to do that?
question. Would you mind if I took time to think about it? Okay, thank you. Okay, so to address your follow-up question of how I would present or prevent this from occurring in the first place, and I think I kind of touched upon it as well in my answer, is one of the things, for example, is a lot of physicians' practices end up being group practices, even in hospitals, you have your colleagues. And so I've seen it myself through shadowing experiences as physicians covering patients for other physicians. And so having some sort of safety or back net, essentially. So in this case, that's one example of how we could prevent this situation. So while this physician was away, his colleague could have took an appointment with a patient, and this could have been addressed hopefully before it progressed to an intracranial hemorrhage. And another example of how we could kind of prevent this is, again, if you're not able to have that sort of group practice, for example, or have someone cover your cases, then as a physician, I might just be reviewing my cases to see who have I not followed up in a while, or who am I expecting to follow up with, or is a high risk patient or a case that I actually need to assign to someone or do something about. Kind of looking at my own physician, like my patient profile, is something that I would look into. Because again, as I addressed in my answer, it's physician responsibility to ensure their patients are cared for. And so that might be something that I look into, as well as one of the other things that I'd mentioned as well. I think something that I would practice as well in the future is really ensuring that patients know that they have multiple accesses to healthcare outside of just a physician's office. I think that's something that we fall into, unfortunately, is patients don't know that they can go to their local pharmacist and bring up health concerns and they can be guided there. There's nurse practitioners if they're available in wherever you're living, physician assistants. And if those avenues aren't clear, then there's always the emergency room, but it's important to inform patients of multiple points of like first access to healthcare other than just your family physician so that we can provide comprehensive care.
Thank you
Yeah,
very much.
thank you.
Okay, you are doing very well. So I'll send the third question. Do you want to answer it with like going through it, like explaining it?
Um, yeah, maybe I could explain this one because I'm getting tired of talking for
Yeah.
8 minutes. But
No,
yeah,
no, no,
sure.
you are doing
We'll
amazing
break it
actually.
up.
Perfect,
How
perfect.
many are there again? I think you sent me a list, but I don't
Five.
remember.
There's
5?
five in total. Yeah.
Mm-hmm.
All
Let's
right,
talk
here.
about this next
Here's the
one.
question. So
Oh,
yeah,
you
you can
sent
just
it.
tell us, or you can
Okay.
have time to think first and then you go through it.
Yeah, just give me a second to reread it. Okay.
Absolutely, take your time.
Needles and syringes.
Take the
Okay.
full 2 minutes.
Oh gosh. Okay. A patient requested needles and syringes at his local pharmacy. They do not present with a prescription. Hmm. Hmm. Please sell this prescription. Mm. Are we at 20? Is it 28?
Yeah,
Okay.
sorry.
All right. So if I were to walk through this question, one I was already doing this in my other questions, but always doesn't matter, new prompt, new question, always introduce yourself, have some sort of even very slight rapport with the person that's across the screen from
Hmm.
you. So I would do that in
Yeah.
terms of introduction. Then again, this was interesting because this is a bit outside of almost like medicine. It's a bit more, I thought it was more pharmacy when I first read it. But it's still sort of like an ethical situation. So the way that I would start this is probably what I've been doing before is kind of signposting. So one of the first things that jumps out to me, and one of the first steps I would take, I would start off talking about like legal considerations because my question immediately is this something that's even within my authority? Like, am I able to provide them these needles, syringes, like just in even a regular scenario? Is that something that pharmacies are doing? So do I have the authority to do so? Would I be breaking the law if I gave these without a prescription? Because that's something that, again, I
Hmm.
have to not only care for the patient, but also for myself as well, making sure that I am actually working according to ethical standards and professional standards and also the law. So
Yeah.
I wasn't sure from that perspective. I don't know too much detail, but I would look into, is this something that I can even do? Because if it's not, then I would refuse to do so. The other thing that stood out to me with this question and that I would discuss is harm reduction, because I think that's really the theme of the question. So um, one, what that is, like what do we mean by harm reduction? Why do we care about harm reduction? Like why is it something that I would be considering in the first place? Because if I was to provide those needles, syringes, right, that's providing safe, clean equipment so that we can not dispel the problem of like illicit drug use or anything like that, but it's to reduce the harms of the situation. So it's actually a public health strategy that's recommended because you want to reduce the risk of things like bloodborne diseases, HIV. We have like an endemic of that in Saskatchewan. And so one of the big ways that we've done it in Saskatchewan is had like prairie harm reduction, have these like SHRIP, for example, but have these harm
Hmm.
reduction policies. And so I would go a bit probably into that side of things of why if this was something that I could do, I probably would do. Like if this was something that wasn't within my authority, I would do as a harm reduction strategy. But then also I think that leaving it at that is not enough. I would try to in this situation maybe even ask more from the patient, like they don't have a prescription, is it just that they don't have a prescription because they couldn't get that refilled, or like what essentially is going on in this context in this situation, and then judge based on that discretion. Again, if I do suspect that this is related to drug use, which is only like a suspicion of mine, I have to first get
Hmm.
information. If I do think though it is drug use, again, harm reduction, but also I think referral to support services, because again, a lot of patients, users, whatever, do not know about any sort of like support counseling that's available to them that they don't have to pay for, that's actually free and will help. And so I think I would refer them to like if there were other harm reduction centers or like drug use or any sort of like initiatives that were in place, I would refer them to that because again, if this is a pharmacy situation, you are one of those like first approach, like first responders essentially
Hmm.
to the public. So I think I would
Yeah.
that's how I would approach this question.
And also, I think it's very important to ask the patient why they need the syringes, like you said, because there
Exactly.
are so many different scenarios where maybe he is traveling from a different country and he ran out or he lost his syringes and he need them for his diabetes. Or maybe he's just getting them for his father or for his son who have
And
diabetes.
in all those scenarios, exactly, like, am I even allowed to, if they were providing such reasons, is this even something that I can be like, oh yeah, here's the syringes, right? Like, is
Hmm.
that you would explore that. And I wonder, like, or is it that you only give these out on prescription? Again, this is like a pharmacy question. I'm not sure if they are able to just hand those out. But yeah, it's important to explore both, honestly, all sides of it, other than the one diabetes thing they mentioned. But yeah.
Absolutely. And also, I think mentioning that you will not stigmatize the person and you will not judge
Mhm.
them for needing needles, and
Mhm.
trying to maintain trust. All those things are also things we could talk about, if that was a question to come.
100%. Like you can, I actually, that's a really good point, and I forgot that I used to do this a lot in my answers because
Hmm.
my brain went from MMI to panel, and then I forgot the eight. I used to because it's 8 minutes, right? And I haven't been
Yes.
doing that a lot today because again, like it's like you just reignited my brain.
Yeah.
Like you do the introduction. If it's an ethical thing, you get into the ethical thing. Often you relate it to medicine because it's or healthcare or
Hmm.
whatever because it's usually related. And even if not, like
Hmm.
generally you can relate it where it's not forced. Like it's usually just a natural, like, oh,
Yeah.
sort of like the ethical standards or blah, blah, blah. And then one of the other things that I would do always, and I would always easily fill up my time, like I was usually never done before I was running out of time usually, is
Hmm.
bigger piece that I would usually do is um any large, broad themed thing. So like stigma in this case would be huge that you can
Yeah.
talk about. I'm starting to see like other questions that we did even like you can even dig more into physician burnout with the last one that we talked about and why you hold them accountable, but also you have to understand that there's a lot that comes with the job. And so looking more into that and protecting physicians, for example, but also protecting patients, like larger things, which I think is actually one of the best ways because then you get less repetitive and you sound like you're really deep thinking. So I would do that. Mhm. Are you still there, or did you freeze? Hello. Oh, are you
Hi,
back?
can you hear me? Perfect. Yes, we
Yeah,
are back.
I was about to just drop it in the chat.
I think it's my internet because it says your internet connection is unstable, so it's my end. That's the problem.
Oh, okay.
But
Yeah.
the even in the first question, you can talk about like emotions. Like the parents are about to lose their child. And there is if you're a doctor in that situation, you will definitely have a strong desire to save someone's life, right?
Yeah.
It's very hard to know how to treat someone and just sit on the side and not do it. So yeah, definitely emotional talks
Huge
can
in
be
personal
very
things
big
as
and strong.
well. I haven't brought that up a lot yet, but this is again like when I was doing this really well, it was
Yeah.
always like not forcing, but like I can find any connection, I would
Hmm.
throw it in there. So emotion, so the things that I think someone can do to stand out that honestly I haven't been doing a lot of right now that I just remembered is the big stuff like stigma being one of it, but like the bigger sort of implications of a question going into
Hmm.
that, playing on like playing more on emotions. So being like, okay, I would be very compassionate to the family. How would you do that? Okay, I would sit them down in a separate room. I would have a conversation about the situation. And that's like the emotional side. Like, this is a really difficult time. And so appealing to emotions and then personal connections, if they make sense. If you're forcing it too much, then they can tell you're forcing it too much.
Yeah,
But that's
that's
the
true.
stuff that really helps you stand out. But then also what we've been discussing this whole time is the meat of it as well. Like you can't miss perspective taking and like showing that you're exploring a situation. You just have to get good at like thinking on your feet, honestly.
100%.
Hmm.
Yes. Perfect. So I will throw the next question. I think we have this one and another one, and that's it for today.
Nice. Okay. Did you? Oh, you did. Hold on.
Yes.
Okay. Your neighbor.
You can have a minute to go through it.
Yeah, I feel like we're gonna run short on time, but let me look. Okay. I think the minute up. Okay. So are we talking through this or what are we doing?
Let's talk through it
Okay,
again.
so um for this question, I think the first thing that my brain thought of, at least in the minute, the way I would approach it is like acute long-term care. Because
Hmm.
one of the things with this one is acutely I'm concerned about the child. It's been a week. They haven't been able to acquire any care for the child. Already was in pain before. Is this like an acute situation where we can get acute care? So does that mean going to an emergency? Does that mean going into even I think they mentioned that I volunteer at a dental care clinic or something? Like, can I go speak to a dentist? They can have a look inside, see what the situation is acutely, because you need to provide that emergent care, right? Rather than even thinking about the monthly payments at the moment.
Hmm.
Acute care is what I would first prioritize, but then I would sandwich that with long-term care. So one of the things is, okay, what have we done so far in terms of, so it says we've looked into different options. What were those options? And so revisit those options. I would look to assist in finding other resources. So, for example, that could be looking online for like dental clinics, calling them, walking in, emailing, telling them of your situation. Can they take on monthly payments? Um, is there other like health programs, like larger scale? So if we're looking into dental, like just private dental clinics and we're not finding the solution, I would offer to look larger, look bigger. So is there like community programs like I don't know, health centers. Sometimes I know like dental schools. I had a friend that was doing a dental hygienist program and they would offer services for like training of their own personnel, but also just like as a volunteer thing. And so, is there other options that we haven't considered? Is a large thing that I would kind of dive deep into in this question. Um,
Hmm.
because I do think that like I know there's like one is insurance, but there's also like what are the other options available? Or is there no healthcare available for? So I think that kind of goes into my third point, which is going to be about advocacy. So not just for this mother and her child, but I think there needs to be advocacy on a large scale that's actually can bring into question our Canadian healthcare system as a whole and providing free healthcare, but then not covering things like medications, optometry services, dental services. Are you saying that dental services are not considered like important to a person's health. Like this can't progress into something that actually could be threatening to their health. So I think advocacy on a larger scale and then diving into our comprehensive healthcare plan and seeing is that something that is suitable? What are like other countries do? Is there a way that we can address these needs? Because this isn't just one mom and her story. This is a lot bigger than that. So the empathy side of it, because I'm someone that comes from a privileged background and my dad has insurance that allows us to get yearly checkups or like yearly cleaning, whatever, from a dentist. So I've never actually had to think about like, what if that never was a possibility? What if those cavities just kept brewing and brewing until like we're losing teeth and it's getting a lot worse and you have periodontal disease? So that empathy side of it of how quite a large portion of the Canadian population, if you consider moms, single mothers that are working part-time, that are doing jobs that are honest, cannot pay for their living, cannot pay for rent, would not be able to afford something like a $500 bill for just a dental checkup or dental cleaning or any dental service. And so
Hmm.
I think with this question, there's a larger advocacy, educational component, awareness component that I would deep dive into.
There's also the aspect of, is it the money that's the problem, or is it something else? For example, maybe she's very busy to go to
Mm-hmm,
the clinic, or maybe
mm-hmm,
she actually doesn't know how to do it.
mm-hmm.
And in
There
this
can also be a
question,
lot of,
other,
sorry, dental anxiety that I forgot to bring up.
right, yes.
People just don't, and a lot of parents, a lot of kids, like just don't go to the dentist, right? Because
Hmm.
they don't like it's painful, it's weird. Why are you like? There's a lot of even stigma associated with that.
Yeah. It could even be a trust issue. Maybe they don't trust the healthcare system,
Yep.
or
Yeah, that's
maybe,
huge. 'Cause dental extractions were a thing of the past where they would just remove teeth. So I
mhm.
think you can even talk about public health, like trust in healthcare system as well.
Yeah, or even for example, if she's an immigrant, she came from a different place where they are okay with that, or
Mhm.
maybe she doesn't know how to use the system.
Mhm.
And yeah, but
You could say the immigrant thing, and yeah, exactly, not even aware that this is something that you're supposed to like, this is a yearly checkup or whatever.
mhm,
Or like, oh, we do need to look into this because it's not just teeth falling off, it can spread.
yeah,
Um, yeah, so the educational piece of it is also big. It gets and kind of what I was it taps into like providing dental care as well, like why
mhm,
that's important. And I think
100%.
a lot of people don't know. If you take it from an immigrant perspective, like a lot of people don't know.
Mhm. Well, yeah, I agree with you 100%. Yeah, perfect. I think that's everything for that question. We really dissected it very well.
Is there anything else?
So
Hmm. That's probably it. That's a lot. Like if you talk about all those points.
yep, yeah, definitely. So I'll send you the last question. Do you have a preference on how you want to answer it?
No, not really. I mean, I don't know. It's up to you. Like I kind of like this too because I feel like we're getting more ideas than if I
Mm-hmm.
just spoke for 8 minutes. I feel like you're not gonna get like I'm
As
actually
much?
like, oh, this is like we're both now like thinking.
Yeah, no, that's fair. Okay,
So
so let's do that as well for this one. And you can have a minute and a half,
yeah,
and
let's
then
do
we
a
can
minute.
start answering. Yeah,
Okay, perfect.
perfect. Thank you.
Mm. Mm. Okay, so for this question, I would again start same thing, introduction, all those things, set it up, signposting if it's possible. So for this question, um, I think one of the first things I would do is not read the papers, like not engage with those papers. And then I would personally approach this classmate. So whether that is in person, if we're able to do so, just because I would want to first get more information about why they were sending these things out. Like first just gauge what they know of, for example, the academic policy. Like they might not even be aware that this is something that is not allowed, for example. And so I think one of the first things I would do is just have a conversation with that classmate so I can understand like why they were doing this. Like, were they just really desperate in a situation where they were like, we're a month in, I don't know, we're really close to the deadline, not getting anywhere. Maybe they thought that, or maybe they were doing fine, but they're like, let me help my classmates out. Then I'll look like the savior. I'll look like someone that's really helpful. Maybe one of the people in our group is having a harder time. Someone could be facing family issues, academic issues. Maybe something is writing on this because it is a very large percent of their grade. This could
Mm-hmm.
be the paper they need to pass and do well on to do great in this class and then apply for a program they're interested in. So there could be a lot of stakes, a lot of pressure, a lot of reasons for doing something like this. And the point is not to use those reasons to justify sending out papers from like upper years and sending that to the class so they can use or the group so they can use. But the point is to first just not blame or judge the classmate immediately based off the situation, but understand where they were coming from and then have that discussion with them about how this is not all right and how they need to take those down and take accountability for that action. And not only for that, but also for the whole group of students that were involved in that. And so the reason that that's important is the values and choices that are relevant in this situation, for me at least. One would be academic integrity and honesty. That's something that you have to uphold, just to not only uphold to your own personal professional standard, but also the standard of the class, the standard of the institution. Why is that also important? Because it also ensures that you are fair to all the students around you. Every time you have a case of academic dishonesty, that is unfair to everyone around you that doesn't have access to those resources to get ahead, or get the grade that you want, for example. So those things, also consequences down the line. Not only is it going to impact your own learning and your own ability to, for example, write a paper for Roman history, or whatever skills are involved in that piece, as well as your classmates, but it's also going to cause further problems down the road. Like if this is something that no one said anything about, was not reported, and then one flies under the radar, it could be unfair to all the other students. The other thing is, if this doesn't fly under the radar, then this is something that they get caught for, and then they could possibly not only fail the class, but be kicked out of an institution and face real consequences for something that they might not have even been aware of. Like they might not have even checked the academic policy. They might have thought this was like completely normal. They've done it before. Like people have sent them things before, that it's fine. Like no one's taking it as a big deal. And
Mm-hmm.
then it's too late once the consequences have been put in place to go back on that, right? To actually learn from that in that way. So I think that's a huge piece of it as well, of why I would want to have this conversation and kind of cut this off at the root before this is something that goes further down the line where you do face those consequences. So if there's even hesitancy on, for example, part of the classmate to take the paper down or do something, you can have a situation where they don't agree with you or agree with your take on it. In that situation, I would then have to take some authority and, for example, talk to the classmate that this is just something that we can't allow. Like, I would have to then go talk to a supervisor if they don't want to, if they don't want me to accompany them, or if they're just opposed to the whole idea. But this is something that I'm trying to stress, that I think I would take just importantly, rather than brush under the rug, because although we're given one scenario, this is something that is common, and it's not just essentially, it's not just the one-time thing. And so again, just for long-term consequences and upholding integrity, that's what I would do in this situation. Just to give you a bit of my thoughts, I'm trying to think of
Mm-hmm.
like, is there
There
larger
are
things you can talk about? Like,
Well, there is one thing you can think about or talk about, which is the credibility of the institution, right?
yeah, I
The
touched on it. I didn't
credibility
go
of the
deep though.
institution.
Yeah,
What's that?
I said I touched on it, but you can go deeper into
Yeah,
credibility.
then I might have missed it, but yeah, the credibility of the institution depends on people not cheating, and if people cheat, then that degree that you get at the end after 4 years mean less if everyone's cheating. And also, you need to think about the two classmates who that student took from them. They might also be harmed by that, and that's something to consider. Maybe they are even like in higher education or something like that, and they could really get impacted by that. A third thing to talk about is that what if because in some classes this is actually allowed to look over past years stuff. So maybe I would check that this is actually against the rules before taking any serious action, and then maybe also talk about how you would um, help that student rectify his mistake or her mistake, maybe by either telling them, okay, you might need to report this to yourself or report yourself, for example, how,
Mhm.
like maybe be a mediator between them and the professor,
Yeah.
advocate for them for the professor, so that they don't get themselves, like they minimize the damage they get.
Yeah, and use
And
systems, and that's what I talked about as well. Like you can just, yeah, be a mediator is a good like support them, assist them if they're
yeah,
hesitant to do it on their own. Yeah.
yeah, exactly. But yeah, to be honest, beside that, um,
I feel like that's it, right? Like how else? Because as I was answering, I was just thinking, I was like, how would I like stand out in my answer? I don't know, but with this one. Because if we talked about the points we talked about,
that's everyone.
seems like we covered a lot.
Yes, but at the same time, I also feel like everyone will cover those points.
No, that's what I'm
So
saying.
the
This
question,
question I actually find difficult because I can't think of more.
Yeah,
Maybe
true.
like if you actually did have a personal example of like a time something like this happened in a class or um
Mm-hmm.
like some like for example we're talking about consequences like how someone you know has actually gone through this or like that could make it a bit more personalized. Then I would
Absolutely, yeah.
remember you more if you like gave me that situation. Again, it's not that you, but I think you can also stress to your, like you have 8 questions, 6 questions, whatever. Like you don't need, like if there's, you don't need to stand out insanely on every single question. Like that's fine.
Yeah, that's
Not
true.
forcing it,
That's
right? Like
true.
because what we just talked about, if someone gave me a solid answer, like if I was judging and I was on the other side and it was 8 minutes and they talked, I would honestly be like, that was good. Like if I
Yeah,
thought they covered all the things,
all
right?
those points. Yes, 100%.
So it's not your
100%.
fault to force anything, but I think yeah, that's at least that's how I would approach. Yeah, as
Very
long
good.
as yeah.
Very good. I think, yeah, that's it for the questions. Number
Mhm.
one, thank you very much for your time and for your help. That
Was
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 very,
that
very helpful.
helpful? Because I was like,
It was beyond helpful, my
I
friend. Trust me.
dude, I wish you caught me like a year ago. I don't have the same like
Yeah, we all are a
little
bit
rusty on
not
that.
as
Yeah.
sharp. But no,
Hmm.
you did amazing. And do you have any um feedback or any advice you want to give at the end or
Yeah, I'm just let me think. Um, that I think just in general for like
mm-hmm,
MMIs, the whole thing. I think
mm-hmm.
one of the things, some stuff we didn't talk, everyone, there's so much you can say about this. Like even with Avros, like I was just doing this a lot. Because when I
Yeah.
came around, like there's a lot of this happen. And then some of them got in, so I was like, oh my God. Um,
Yes, yes, some of them did.
so it works. But I think just with these, a large part of it is like you are also showing your personality, right? And so I think one
Mm-hmm,
of the things that helped me is like, yes, I was nervous and like blah blah blah, but like I didn't shy away from like trying to show myself through my answers. Like sometimes like you can have someone that's like very critical and very logical and like is really good, but then you can't really connect with that person, right? This is
mm-hmm.
maybe
Yes.
more of a panel thing than it is MMI, but even in like panels, like if I actually had an opportunity, I'd be like, yeah, like I think my mom is my superhero. Like then I'd give like I just every time someone like I'm on the other side and someone's answering, anytime someone does something like that, like I'm immediately sucked in to that conversation,
Mm-hmm.
right? Because
Yeah.
it makes
Make it
such
personal.
a
Mm-hmm.
difference. But then also, I'm trying to think like that's number one. But there was what else was it? There is one like one other thing that I think people kind of brush over and I didn't do as much but like
Mm-hmm.
I think it's like yeah like acknowledging the other person from like that you're talking to like again MMIs is a bit more difficult but like you can bring up their name one or other times like when you're like I'm done do you have any follow-up questions whatever like if
Mm-hmm.
it could just be a
Right.
slight like slip in um, but like, or like in the end, like, thank you so much for your time. And you're like, whoa, like what? It's
Yeah.
like dumb, but like it's just things like that. Like there's a whole aura that you're bringing to the screen,
True.
to
True.
your answer, even in that Kira talent prompt thing. Like, so like it's more than just what we're like saying in this.
That's very, very true. And eventually, big like part of part of being successful in the interview is to make the interviewers like you and to make them feel
Exactly.
like, yes, I want this person to become and to be my colleague, to
Exactly.
be
And I
my
think
student.
people say that shit, but I feel like people don't actually use that. Because I feel like that's
Yeah.
what I did in my panel. I was like, I don't think I said the smartest stuff, but I was just
Hmm.
like, if I were to give examples of who I was as a person, like I would just try to give them more of that.
Hmm.
So that they're like, oh, we just like, yeah, she seems cool. Like it
Yeah.
works. I think
Yeah.
the
No, that
other thing
exactly. Yeah.
it's just like also the other thing I think that was really important in Avros that I was doing with a lot of them because they were all really stressed out, obviously.
Hmm.
I was just like basically like it was like therapy at this point. It's gonna be okay. Like I was like because they were like freaking out and I'm like, well, yeah, it's like normal to freak out. Like you're gonna freak out, but like what I at least heard from last year's panels was like people were like actually losing it. Like they were crying, like they were like they could not contain their emotions and themselves in the moment,
Hmm.
which is really sad because then if someone's prepped a whole lot and then they just kind of lose it, then it doesn't.
Yeah. No, 100%.
Make sure that you
Sometimes
reiterate
under
that
the
to
pressure,
me.
yeah.
Like,
Sometimes under the pressure you end up, yeah,
yeah, like when
breaking
you're
your
giving
own.
them advice, like you're gonna tell them so many things and they're gonna practice all those things, right? But it's also like
Hmm.
fine, like don't be like I guess what I'm trying to stress is like put a human element on it. Like don't be like, I didn't
Exactly.
connect it to med, like I forgot to talk about stick, like it's fine. Like
Yeah, that's true. Eventually, it's
develop
about
it.
the answer, and you mentioned it very
Mhm.
well. Like have a human element to it is very
Mhm.
important.
And then you'll be good. But yeah, I
Yes.
wish you the best of luck with this whole thing
No,
and
perfect. I'll just stop the recording now.
Mhm.
I should want to stop.